It is absolutely clear that we Aboriginal people are a priority group in political rhetoric only.
This is a nightmare.
In Wilcannia, 7% of the town's 750 residents have COVID. Michael Kennedy is one of them.
Every day we just make phone calls to all the other family and friends in town that have, been tested positive to COVID, so it helps us from a mental standpoint to get through each day.
Most people here are Aboriginal, and many have chronic health issues. Houses are overcrowded, and it's a 2-hour drive to the nearest major hospital and supermarket. As more positive cases are confirmed, the community finds itself in a situation it desperately tried to avoid.
Roughly 18 months ago, we sat down in a lot of meetings in the community, and we wanted certain measures put in place to try and help stop the spread from hitting our little community. But every time we left the meeting, it was just like it fell on deaf ears.
More than 400 people in Western and far western New South Wales have contracted COVID, and the majority are Aboriginal.
There you go. No worries.
Less than 7% of the region's Aboriginal population is fully vaccinated.
You always cough, or is that a new cough?
A vaccination blitz is now underway, bolstered by the military and the Royal Flying Doctors Service.
Thanks, everyone. Thank you.
We decided to go door to door for some of our more vulnerable communities. So we've been down at Alice Edward Village, going door to door down there, with our Aboriginal health practitioners taking the lead.
Yeah, so this is line up.
But some, like Gadooga resident Bayami Williamson, say it should have happened sooner.
But everyone's really bloody worried.
When they actually wanted to get vaccines into people's arms out here, they did within a week. So it's got nothing to do with remoteness.
There has to be some accountability here, and those communities in Western New South Wales are calling for that accountability.
Aboriginal health experts raised the alarm almost 2 months ago as the Delta strain snaked its way through Sydney's east.
We certainly advocated in the beginning of July that we needed to upscale the vaccine rollouts within our Aboriginal communities when we knew that, particularly in the eastern suburbs of Sydney, there was an outbreak.
The state's peak body for Aboriginal health organisations requested a COVID hotline and mass vaccination hub for First Nations people and called for an Aboriginal-led rollout in regional communities. Epidemiologist Peter Malouf says those requests were ignored.
We have Aboriginal doctors, we have Aboriginal epidemiologists, we have Aboriginal nurses. We should be at the forefront of leading the COVID response for our communities, not left with non-Indigenous bureaucrats telling us what we need to do.
A month later, the virus took hold in Aboriginal communities in Western New South Wales, and the lagging vaccination rates were laid bare.
We would have all liked far more vaccine to have been in those more remote communities because it was identified last year.
Federal health data shows weekly vaccine doses for Indigenous people across the state got off to a slow start. In the West, Aboriginal medical services say their mostly younger clients were reluctant to get AstraZeneca due to changing health advice. Most only received Pfizer last month. Since then, the number of weekly injections has shot up.
When you're only getting 100 or 200 vaccines a fortnight, and sometimes we weren't even getting that, you cannot maintain connection with our community by offering something then not able to deliver.
In Orange, the community is scrambling to contain an outbreak, with several Aboriginal children infected and one elder in hospital. A spokesman for Health Minister Greg Hunt said Aboriginal health services, including Orange, were among the first to receive vaccines in March. But Jamie Newman says it wasn't enough, and he requested more supplies weeks before the virus hit.
Lives do matter beyond the Blue Mountains, and we've been saying this I've been in health 20 years. We matter, and we need to have vaccines out here.
Prime Minister Scott Morrison has blamed remoteness and hesitancy for low vaccination rates in Aboriginal communities. And today, the New South Wales Premier weighed in.
certain vulnerable communities were earmarked to be vaccinated by the Commonwealth many months ago, and we're addressing those issues now.
The fact is, talking of vulnerabilities only, it really hides the fact that our people have been put at additional risk by a negligent state government and just an astonishingly incompetent federal response.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.